Okay, well, I want to officially welcome everybody to our Survive and Thrive webinar series today. We're glad that you're with us, and we are excited to have Mari Gali leading our discussion. And today we're going to be focusing on integrative oncology practices, evidence-based research, and applications. Before I give the floor over to Mari, though, just a reminder, we are the Texas Oncology Foundation, and we are dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. And we do a lot of community events through our Survive and Thrive programming. These webinars being one of those. We also have a caregiver support group that we encourage all caregivers to join. They meet the first and third Thursday each month. We do our virtual experience, which we just wrapped up a little less than a month ago, which is a month-long experience where we have webinars and interactive workshops and support groups all within a 3-week program. And then lastly, we have an ambassadors group that has been forming. So anybody that has participated in any of our Survive and Thrive programming is welcome to join that ambassadors group. It is a peer group for connection, support, and just friendship. Next, I want to just go over some Zoom housekeeping. This is a webinar today, so we cannot hear or see you, but you can hear and see us. If you are having technical issues, such as your audio or the slides don't seem to be progressing, sometimes the best option is just to exit out and rejoin with your link. If you are having audio issues and you are on a computer, the best option a lot is just to dial in. And if you go to your Zoom tab against the bottom, you're going to see your mute button. There's an arrow up and you can select phone and it'll populate the phone number for you to dial in. We do want to hear from you. We want to know your questions. We want to know your thoughts. So please continue to use that chat throughout this presentation. We are going to save questions for Mari until the very end. So we're going to let her present and then I will come back on and host a Q&A session. But please don't feel the need to hold your questions till the end. Send them in the chat and we will get them all answered. Lastly, I just want to remind you that this session is being recorded and a copy will be shared with all registrants in a follow-up email. All right, as I mentioned, we have Mari Gali with us here today. She is a licensed acupuncturist specializing in oncology acupuncture. She is with Cancer Rehab and Integrative Medicine there in Austin, Texas. She's a board member of Regarding Cancer and co-founder of Moving Beyond Cancer Collaborative, which are both nonprofits. Mari really does a lot for the oncology community, and it's so evident her passion when you get to talk to her. It's just clear that she's truly here for those in cancer and their families. She's providing the support and the tools that they need to get connected with. And so Mari, we're so glad you're here with us today. Thank you for your time.
Thank you, Kelly. Thank you so much for the introduction. And good morning, everyone. I hope everyone's doing well. It's a little cloudy outside, but it's a good day to kind of stay in and stay snuggled in. I am excited to be here. I'm going to share my screen I'm excited to be here to talk a little bit about integrative oncology, integrative medicine, and hopefully empower everyone by the end of the session to develop a support care plan for yourself and give you some tools to do that to help you navigate treatment and side effects during treatment and in recovery. And we'll also touch base on just some research that's been going on in the past few years to support integrative oncology. So first we'll chat about what on earth is integrative oncology and go into traditional Chinese medicine, acupuncture and acupressure. We'll talk a little bit about some mind-body and meditation resources, symptom management, and then take some questions at the end. So what is integrative oncology? Integrative oncology is a patient-centered, evidence-based field of cancer care that utilizes mind and body practices, lifestyle modifications from different traditions alongside conventional cancer treatments. So we are using as many tools in our toolbox and working with practitioners that have an oncology specialization in their field to support you and your oncologist and your nurse team as you go through treatment. So we're talking about nutrition, meditation, oncology, acupuncture, physical therapy, oncology massage, exercise, physical exercise, movement and breath work, reflexology, oncology aesthetics. Sometimes after treatment, radiation or chemo, you may notice that your skin changes or having some skincare issues. There are specially trained oncology estheticians that know how to help you with that, as well as counseling. There are specifically counselors in their field that work with oncology patients and can know how to help guide you through treatment and after the fact, as well as help your family members and loved ones. So integrative oncology is definitely an umbrella term that speaks of the many different practitioners and practices that you can utilize as you're going through treatment. And we want to be able to support you and your body while conventional cancer treatment is treating the cancer. I spoke a little bit about the last slide. I mentioned the term evidence-based. Evidence-based medicine is a systematic, according to the National Cancer Institute, a systematic approach to medicine in which doctors and healthcare practitioners, they use the best available scientific research, as well as their individual practice and their clinical background, and they take into account you as an individual patient in order to develop a best treatment plan. So when I say evidence-based medicine, like acupuncture, integrative oncology, we're using evidence-based medicine, and many practitioners and oncologists do use evidence-based medicine when they develop your treatment plan. So they're taking into account the newest research, like I said, plus their personal experience as a practitioner, but then listening to you and understanding what's important to you. What are your main goals to get through the day, but then your future goals after treatment, and putting that all together to develop a plan of care as well as, cancer care plan, but then supportive care. So whenever I speak with my patients, I want to make sure that I understand them. I understand where they're coming from, what's important to them, so we can figure out what our goals are when we work together as they're going through treatment and after treatment care. If hiking is very important to you, or crocheting or knitting, maybe we need to make sure that we can do everything possible to prevent neuropathy or muscle pain or joint pain. And then I'll tailor that to maybe do different suggestions as far as which exercises to do, or which type of acupuncture treatment, or which type of nutrition support, and when to use nutrition support, things like that. So really getting to know the patient includes evidence-based medicine. This is just one little study regarding when integrative oncology is used. There was research showing that an integrative oncology treatment program in survival patients with advanced gynecological cancers. This was a small study, but it did show that those who adhered to integrative oncology treatment program was associated with higher survival rates among patients with advanced gynecological cancers. This leads to the need for larger prospective trials that can be explored in order to enhance patients' resilience and coping, as well as adherence to oncology treatment. So another aspect of why do we want to have a supportive care plan, and why do we want to work with an integrative oncology approach? If we can mitigate symptoms and side effects when you're going through treatment, people are much more likely to be able to finish treatment, finish that 10th, 11th, 12th Taxol treatment if their nausea has been managed through acupressure at home or massage or reflexology. So I think that this is something that it's very exciting that is now being researched, and it can be explored further and to better patients' experience and your quality of life. I do want to talk a little bit about acupuncture and traditional Chinese medicine. I am an acupuncturist. I have my doctorate in acupuncture and Chinese medicine and focused on oncology care. And this is another umbrella study that traditional Chinese medicine, it incorporates acupuncture, which is probably the most well-known. It's been around for quite a while and is much more in Western clinics, traditional clinics now, as well as herbal medicine, Chinese herbs. This is something that I really don't prescribe much with my patients that are going through chemo or radiation. We want to make sure that there are no herb drug interactions and being really mindful of liver toxicity and everything. So I rarely prescribe herbal medicine when patients are actively going through treatment. And that would be something that your oncologist would have to agree with, and we'd have to make sure it was managed well. So this, herbal medicine, even though I am an herbalist, during treatment, I do not really prescribe herbs. After treatment, after the fact, as long as it's given the okay by the oncologist and there's proper communication there, then we can help because herbal medicine is wonderful for symptoms and side effects, but it's usually kind of benched when you're actively going through treatment. But we can use the following. So mind-body therapies, Qigong and Tai Chi, meditation, are very, very helpful, and research supports all three of those in terms of navigating certain side effects and symptoms and just quality of life for all of us, really. And then there's food therapy. So food therapy is a little different from Western nutrition. Eastern nutrition and Western nutrition complement each other, but they have different properties. So I work a lot with food therapy suggestions. And one example would be like, if you have nausea, try some ginger chew, or peppermint tea, bone broth, or congee. Congee is like a rice porridge, is really good for building energy. So trying to use food as medicine at just a base level of what we put in our bodies can really help us manage symptoms. And then cupping therapy. Cupping therapy does fall under traditional Chinese medicine. This is something also that it's great for tight muscles and soreness, but it's not always used during treatment or after treatment because it does have an effect on the lymphatic system, and we have to be mindful of that when you're receiving treatment. And then just a little side note, I imagine we're all in Texas here. Licensed acupuncturists in Texas do have a rigorous program that they have to complete. It's a 3.5, 4-year master's degree. And then we have to take 4 national board exams and pass all of them, and then take the Texas licensure state exam, and we are governed under the Texas Medical Board. So if this is something that you want to try, I just encourage you to make sure that you go to a practitioner who has that LAC, a licensed acupuncturist, and has their master's degree or doctoral degree study with that. And with oncology care, it's best if you can find someone who has advanced oncology training. I realize that is difficult sometimes based on where you're located, but if anyone's ever interested, I can help provide a database of practitioners that do have that training. All right, so today we're going to do a little bit of acupressure, self-care tips at home. Acupuncture itself is the insertion of hair-like thin needles that are placed in very specific points on the body, and this encourages a healing response in the body, and it stimulates the nervous system. So there are acupuncture points that respond when needled. The limbic part of our brain, which is like where our pain sensors are flying off, research has shown that can actually calm down when certain points are needled. There are other points on the body that can calm inflammation responses in the gut. So if you're having IBS or diverticulitis, or your gastrointestinal tract is inflamed, there are acupuncture points that have been used for thousands of years to help with these, but now we're actually doing research to show that inflammatory markers are turning off when that point is stimulated, which is really exciting because now we're able to see kind of working backwards, a practice that has been utilized for 3,000 years. We're now actually able to see in Western medicine through functional MRIs and different research trials that this actually does have an effect on the body. And acupressure is the practice of holding or pressing or massaging specific points on the body from 30 seconds to 2 minutes at a time in order to stimulate a response in the nervous system. Now, acupressure isn't quite as strong as acupuncture, and there's certain symptoms that the research isn't there to help with, specific symptoms. For example, hot flashes, we treat them often, but realistically, acupuncture is just much more stronger of a treatment than acupressure. But things like nausea or headaches, pain, energy, fatigue, these are things that you can do at home. And we're going to talk about that today in a little bit, which points we can do for what symptoms. Acupressure seeds, I'm going to show you. So acupressure seeds are these little seeds with tape on them that can be placed on the specific points in the body. And it's a way to keep the treatment going or give yourself a little treatment. It's best if an acupuncturist places these on for you and guides you how to do it, because there are about 500 points on the body. So a little off might be a different point. But we'll talk today about this as well. I'm just going to kind of show you in the video here. So these are the seeds. This is the front. And there's a little metal. Maybe, let's see here. Oh, I'm not showing you on the camera very well. There's a little baby right here, and it basically holds the point that I would usually needle. And these are acupressure seeds you can buy on Amazon. You can buy online. Your acupuncturist can give them to you. I try to remember to always give acupressure seeds for my patients on their way home, and it just helps keep their acupuncture session going quite a bit longer. Qigong is a practice that combines body movement, relaxation of the muscles, meditation, and breathing exercises in order to improve mental, physical, and emotional health. So this helps with a variety of concerns that we often see in the oncology care world. For cancer patients specifically, research has shown that Qigong can help with neuropathy. Neuropathy is something that is caused from certain chemotherapy agents, numbing and tingling in the fingers, anxiety, fatigue, insomnia, and pain. So this is something that you can do at home, seated or standing if you'd like, 10 minutes a day. It doesn't have to be a really long session for you, but if you can start in the morning and do a little bit of Qigong or late into the evening, it can help wrap up your day, or it can help get you going for the day. Some resources for Qigong at home. I'm just going to do online resources that are on YouTube just in case anything ever changes, but seated Qigong is called Shengzhen Qigong. We studied this in our education, but there's a YouTube link here, and if I'm not sure, I can check with Kelly if this slide will be available after the fact, but we can make it available, or I can have Kelly email everyone the basic resources that are given in this slideshow today. But Shengzhen Qigong would be something that can be practiced. I think not sure if you can see this, but we'll just do just a few, minutes of it. So you can see he's doing very gentle movement and breath work. And it doesn't seem like too strenuous, but it actually is wonderful for increasing oxygenated blood throughout the body. And so for the fingers, for the toes, for balance, for anxiety, because you're deep breathing, you're going to calm that vagus nerve down. Qigong is something that almost everyone can do to some degree, and it's incredibly helpful for you. Moving Beyond Cancer Collaborative, so the nonprofit that I am a part of, we do have online videos as well, and a live series that's available. And if anyone's interested, we can always link that website too. Alrighty. And then there is Tai Chi. Tai Chi is a little bit more energy consuming than Qigong, but it is a traditional Chinese practice in martial arts. I think maybe it's a little bit more well known than Qigong. Tai Chi involves a series of movements, coordinating the arms, legs, and breath in order to benefit balance, circulation, body, and mind strength. So studies have definitely shown that Tai Chi can help with balance, with muscle strength, flexibility, stamina, mental health, and relaxation. Anyone who is dealing with, neuropathy or weakness, like feeling weak after treatment, doing very simple Tai Chi exercises and building up your stamina is absolutely recommended. And there's actually at the Memorial Sloan Kettering Cancer Center, there are free Tai Chi videos online. And this just shows that, with oncology care, cancer care, there's research that backs this up and there's support within the community. So this YouTube channel is wonderful, and the instructor guides everyone through the different series. So that's on YouTube. It's on the MSK's website, and let's see if I can play a little bit for you. I won't get into too much, but just so you can see how it's more standing. Definitely more standing and movement. And it's all gentle, and you can go at your own pace. And this Tai Chi and Qigong meet you where you're at with energy levels. And then meditation resources. There's breath work. I know we've talked about in the past, but box breathing is really simple. If you're ever feeling anxious or nervous or need help with fatigue, box breathing is just breathing in for 4 seconds, holding for 4, breathing out for 4 seconds, and then holding before you inhale for 4 more seconds. There's also 4-7-8 breathing, which is breathing in for 4 seconds, holding for 7, which is a little bit more challenging for some, and then breathing out for 8 seconds. And what that as well as like alternate nostril breath work, which is holding one nostril down, breathing in, and then switching and breathing out through the opposite nostril. Breath work along with guided meditation and imagery. It's wonderful for many symptoms and side effects from cancer treatment. We'll go into that here in a little bit. But just for some resources, the Calm app, Headspace, those are both apps where you can find guided meditation or stories or guided imagery, as well as YouTube or iTunes will have it as well. And Yoga Nidra is another specific type of guided meditation where your whole body is relaxed throughout the 30-minute process. So Yoga Nidra is much longer than most guided meditations. And there's a lot of resources online for that as well. These are all free. Or the Calm and Headspace usually have a small fee, but YouTube, iTunes, especially YouTube, and then the Moving Beyond Cancer Collaborative are free options. As far as food therapy goes, from a Chinese medicine perspective, traditional Chinese food energetics, the Helping Ourselves, a guide to traditional Chinese food energetics, is a wonderful resource to start if you're interested in more of Eastern food therapy. It does talk about like symptom-based as well as like constitution. If you're feeling weaker, there are certain foods to help build that up. And then the Cancer Fighting Kitchen cookbook, I love. We have 2 copies in our clinic for people to look and take home or whatever they need. And we recommend it to many people. But the Cancer Fighting Kitchen cookbook will have symptom recipes based on symptom, recipes based on where you're at in treatment, week of treatment, week off of treatment. It's wonderful. Some of the recipes are a little tedious. So if you have someone around you that loves to cook, or if you can cook on day off when you're feeling better, a week off of treatment or on the tail end before your next session starts, I highly recommend utilizing this cookbook. It's on Amazon, it's on Kindle, and if you're in the Austin area, you just want to check it out, you can always just come and take one of our copies and bring it back. Okay, so after that, I want to talk and go into very specific symptoms and what you can do at home to help yourself. And again, during this time, if you have any questions regarding what I'm talking about, please put it in the chat and we'll circle back at the end. So I often see fatigue, neuropathy, stress and anxiety, sometimes depression, joint pain, hot flashes, nausea, vomiting, as well as diarrhea and constipation. And a little note, if you're experiencing any of these symptoms, make sure you're always consulting with your physician and your oncology, healthcare team regarding any concerns, just so they're well aware of these issues going on. With fatigue, fatigue is kind of a broad concern and symptom and side effect because so many things can be causing fatigue. Firstly, anemia. There's two different types of anemia we often see: thalassemia or iron deficiency anemia. So B12 or iron deficiency can absolutely cause fatigue where you just cannot get your energy throughout the day or you feel winded sitting up. Lack of sleep. If we don't have good quality sleep, of course, we're going to be tired. And then sometimes it's a really nasty cycle. So check in to see why we're fatigued first. And stress. I don't know if we give stress enough credit for what it can do to our bodies and our mind, but stress is incredibly taxing on us, and it is incredibly tired to be in a heightened state of stress all the time, which is why choosing a few things to help you with stress management is so important. Nutrition deficiency during treatment, based on if you've had surgery and what type of surgery you've had, there might be some malabsorption going on, and this is something that you definitely want to talk to your oncology dietitian about, to your oncologist and nurse navigators about, checking in to see if they can do any follow-up blood work to figure out how your gut is doing absorbing food. And then just plain side effects from chemo. A lot of the side effects from the chemotherapy agents are very fatigue inducing. So giving yourself some grace when you can't understand why you're so tired all the time. There's tired because you didn't sleep one night, and then there's genuine fatigue that I am sure a lot of you or your loved ones understand. It's just different from what the average person deals with of not getting one night's sleep. This fatigue is it can affect our daily lives. So with that, what can we do about it? Again, of course, always check with your physician, do the blood work, meet with the oncology dietitian. And if all is okay, if you need an iron supplement, if your hemoglobin's low, if your ferritin is low, I personally really like Florivital or Floridix. It's a liquid iron. It doesn't cause constipation like some tablet forms. And you can check with your doctor as well to see based on what their recommendations are for dosage. With diet, a lot of people love smoothies and greens. When it comes to green smoothies, I do recommend to my patients that if you get one from a store, if you make one, cut it in half and add water. It can sometimes be a little harsh on the stomach to have a very raw, cold drink on your stomach. So if you really want one, cut it in half, add water, save the other one for the next day. But there are some alternatives. Like I love warming drinks like bone broth, chicken broth, whatever nutrient-based warm drink you can use. But bone broth is great that you could have one little cup a day. And then congees. This is all more of Eastern medicine food therapy. A congee is a rice porridge where you can make 1 cup of rice for 8 cups of water, and you slow cook it. Either put it in a slow cooker for 8 hours, or if you have like an instant pot, it still needs to be cooked for a good 45 minutes until it is mushy. And you can add different foods in it. So like shredded chicken and mushrooms, or if you like congees for breakfast, then it's very nourishing. You could add maybe a cinnamon stick and some slices of ginger. That would be a good thing to have a little bit of ginger on your stomach if you are prone to nausea or just upset stomach, not feeling settled or having a sluggish digestion. Having a congee for breakfast is wonderful. And And then exercise. So pace yourself and listen to your body, but sometimes you do need to try to get moving with the fatigue. Even if just walking to the mailbox and back, or walking from the living room to the kitchen, wherever it starts for you, figure out a way to start moving a little bit at a time and start gaining some momentum. Because the more oxygenated blood we can get throughout our body, the better. That's where the Qigong and Tai Chi come in. So I wanted to touch on that before I start recommending things. Acupuncture and massage, I work with patients with fatigue all the time. And I do recommend having an oncology training in oncology is highly recommended, but any licensed acupuncturist hopefully will be able to help you with fatigue after treatment. There are some acupressure points, DEW 20 and stomach 36 are the 2 points that we use often for fatigue, and we are going to learn them now. Say you had your handy dandy acupressure seeds, or you can just tap. The first point is DEW 20. It is at the top of the head. If you have your 2 ears, the very top of your 2 ears, make a line, and where it meets the apex of the head, right here. And it's a little sore, but we can press that like the acupressure 30 seconds, or you can tap, massage. This is really great for like mental clarity as well. Energy, clearing the mind, and concentration. Then for stomach 36, it is a point that is to the lateral side, the outside of your leg, 4 finger lengths down from your kneecap. So you find the bottom of your kneecap and you would place 4 finger lengths, and then you'll just move 1 finger length outside to the lateral side of your leg. It'll be like a little indent, and it's usually quite sore on people. So you can massage that as well. It's a master point in acupuncture world. So if you've ever had acupuncture, you've probably had this point needled. But this is another point that's great for energy. It's wonderful for calming inflammation down in the body. And it's something that you can do at home. Just massaging it for 30 seconds to 2 minutes, maybe 1 to 2 times a day is great. And then peripheral neuropathy. I'm going to talk a little bit about like, what is it? I think some of you probably understand this. Hopefully none of you are experiencing it. But if so, it is numbing and tingling or prickle feelings in the hands and feet, sometimes in the arms and legs as well. Sometimes it is hypersensitivity to extreme temperatures. So someone might say, well, my fingers aren't numb, but I can't take a hot shower, or my fingers aren't numb, but I can't wash my hands in cold water. It's painful for me. Those are signs of peripheral neuropathy. Sharp stabbing or burning pain, as well as noticing any like balance issues, or you're walking a little different. That can all be signs that there's some peripheral neuropathy creeping in. Unfortunately, 30 to 40% of patients undergoing chemo will experience some type of peripheral neuropathy. And there's quite a few chemotherapeutic agents that do cause neuropathy to some degree. And there's acute neuropathy. So if you're going through treatment and you're like, oh, it's only numb for like the first couple of days after chemo, and then it gets better, that's a different type than when patients notice that, oh, this is not getting better, and like a month has gone by and you're done with chemo, or 2 months has gone by and you're done with chemo. So I really want to encourage everyone to start doing some self-care tips that we're about to talk about if you notice any of these symptoms. Supportive care, there's acupuncture, electroacupuncture can alleviate or reduce these symptoms. Early intervention and frequency is very important. So most research shows that when acupuncture, which is electrostimulation, acupuncture is helpful for neuropathy, people are coming in twice a week for like 5 to 6 weeks, and then once a week after that for another 4 weeks. And it's difficult to do that sometimes because everyone has a busy schedule, and sometimes insurance does cover acupuncture, but sometimes it doesn't. So it adds up. So if reflexology, and as well as reflexology and massage, those have been known to be very helpful for neuropathy. If neither of those are options for you, we can do some things at home. So exercising, tapping, which is, these are little acupressure points. We'll go over here in a minute. Ba feng, they're called. And then ba xie, like the webs in your feet and fingers, we can tap them. So with one hand, make kind of like a little bear claw and tap the webs of your fingers, just increasing blood flow to the area. And then also some movement. So different exercises that you can do, like moving your fingers around. This can be really helpful. Epsom salt baths, if there's no concern about taking Epsom salt baths, you can soak your feet in warm Epsom salt water, legs all the way down, take a bath. That can be really helpful in just increasing circulation. Tactile therapy, if you can go to the dollar store and get some containers, get cotton balls, get different textured sponges, get Mardi Gras beads, anything that feels like a different texture to you, and spend some time every day placing your hands for 30 seconds in cotton balls or rubbing them around your fingers, and then put your hands in Mardi Gras beads. Feel the different textures. We want to be able to send signals, make your nerves work together to send signals back to the brain and keep that loop going. Making them work hard together, increasing blood flow, all of this is going to be helpful with tactile therapy. And then the different textured sponges, again, just telling your nerves, oh, what is this signal? Like, what does this feel like? What's this sensation? Better send something new, a new signal back to the brain. CBD cream, topical. I don't recommend, CBD orally because I just don't know what everyone's cases are based on everything else that you're taking. But topically, there's a CBD and menthol cream that a lot of my patients use. They put it on, especially at their feet. If your feet feel staticky from the neuropathy, putting that on at night can usually calm them down and help people sleep. There's also hot and cold water. If you are not hypersensitive to temperature changes, get 2 bowls, hot water, cold water, obviously nothing that will burn you, but hot, definitely hot, not just warm. And we want to go back and forth between hot and cold water, alternating in order to make your blood vessels constrict and dilate. So placing your hands in hot water for 5 seconds, quick submerging them in cold for 2, back in hot for 5, back in cold for 2, doing that back and forth. Start out with just like 15 to 30 seconds if you can, and then work your way up to 3 minutes, and doing this every day as well. All of these little things can make a big difference. And I think my patients who, come to acupuncture and do their bit of getting acupuncture twice a week, the ones who do the homework, I see better results. We talked about this, but just again, with the neuropathy acupressure points, the webs of each finger, and then the webs of the toes. And these can be tapped, massaged, or pressed down. This is just a little research showing that chemotherapy-induced peripheral neuropathy, acupuncture resulted in significant improvement with the symptoms. And this was a pilot study, so it demonstrated that not only was the study, it was feasible to conduct the research, but it would be feasible to do a much larger sample size as well. But early research, as well as the clinical data, is showing that acupuncture is quite helpful for neuropathy. And then stress, anxiety. I understand that this diagnosis, whether you're listening here today as a loved one and caregiver or patient yourself, it is incredibly stressful. It can cause anxiety, it can cause panic attacks. Of course, always talk with your physician, make sure that your team knows that you're experiencing any of these feelings, and let's get some tools together to help you. There's talk therapy. There are, like I said before, there are counselors that have advanced training in working with oncology population. There's cognitive behavioral therapy, things like something called EMDR, eye movement desensitization. That can be really helpful if there's, after the fact, say you're done with treatment, but you're dealing with some recurrence anxiety, or you're now just processing what you just went through, and there might be some trauma there. Talk therapy and cognitive behavioral therapy are incredibly helpful. And depending on your insurance, there's coverage there, and there's usually practitioners, and especially now that there's so much available with online therapy within the state of Texas, thanks to COVID, there are practitioners available to help with this. Acupuncture and acupressure, things that you can do at home. There are very specific points that have shown to reduce that fight or flight anxious reaction in your body. So even if your mind is not anxious, but your body has a panic attack and you can't tell why, there's actually points that can help with that. So home care, we talked about guided meditation, finding an app that you really like, or having like a picture in your wallet or your purse that brings you peace. I know I love visiting a very specific place where my mom is from, and it's beautiful, and it reminds me of happy times, right? Having that picture near you that you can look at and take some breathing, breath work, that's really, really helpful. Doing exercise, like get your body moving, get some serotonin and endorphins released, right? So figuring out what, of course, you like to do, but cardio, movement, yoga, tai chi, seeing friends or family, and having them join in with you with the exercise. It's very, very helpful for anxiety and stress. It's something that should incorporate in your everyday life. And manage your caffeine intake. Sometimes people come in, they haven't had food yet, but they've had 2 cups of coffee and they're not sure why, they're all stressed out and feeling jittery. Be very mindful as you're recovering from treatment and when you're going through treatment, how much caffeine are you taking in your body? And regular sleep when waking routines. It can be easy to get thrown off, but really trying to have a good sleep hygiene, having your sleep schedule every night and waking up at a certain time, very, very important for anxiety and stress to not get away from you. And then there's acupressure. So acupressure points that we've talked about, there's some points right here I'm going to go to next. Let's see, not sure if my little screen is blocking the images. But there's something called Shenmen, and it is in the ear. It's on the earlobe in the triangular fascia of, I call it the fish eye. It's right down here, and you can massage this point yourself. So massage this and press on it, put an acupressure seed. If you have an acupuncturist, tell them, make sure you needle that point. There's a point in between your eyebrows. Some people call it the third eye. It's called yin tong. It's wonderful for racing mind, stress, anxiety. And then Ren 17, which is located down by your 4th rib on your sternum. So right on your sternum, it's quite sore point. It's almost like when you follow your sternum down and it finally dips. That is Ren 17. Pressing that is great if you ever have like chest tightness from stress. And then joint pain, muscle cramps, so many things that we can do for this. So like I said in the past, the CBD and menthol that we use for neuropathy, great for muscle pain and joint pain. Magnesium lotion. Magnesium is the active ingredient in Epsom salts. So if you notice like, ooh, after an Epsom salt bath, my muscles feel relaxed, just buy some magnesium lotion and you can apply that, especially if you don't have time for a bath, or you want to put it on in the morning and then go to work. Gentle exercise and movement. So there are some drugs after specific types of cancer treatment called aromatase inhibitors that can cause joint pain. So doing walking or qigong or tai chi in the morning and getting that movement happening, very, very helpful. Back to, oncology, massage, PT, acupuncture have all shown to help. And then electrolyte tablets, make sure you are not electrolyte deficient. So make sure your sodium and potassium are the numbers that they need to be. Talk to your physician about this. And if you need to supplement with an electrolyte tablet, please do so. There's plenty in the market, and of all varying costs. Usually just tablets you can put in water. So you don't want to add too many extra sugars. Like I know Gatorade is sometimes delicious, but it has a lot of sugar and a lot of additives. So just sticking to those electrolyte tablets would be really helpful. And then, so joint pain and acupuncture. This is what I talked about earlier just now, the aromatase inhibitor. Acupuncture has shown that it can significantly improve joint pain. with aromatase inhibitor-induced joint pain after early stage breast cancer. A lot of times people are put on that drug for 5 to 10 years. And what can you do at home? So LI4, it's a very common point. I feel like there's even on Amazon, you can buy clips that will hold this point. I've seen them because it's great for headaches. It's great for just general pain. This is the point I mentioned earlier, has an effect on the limbic part of our brain, which is our pain sensors. So we're going to make a little, have our hand out. This first long bone, your metacarpal bone, we're going to go halfway and then go into the web, the meat of our hand here, and press on that. It's going to be a little sore, but this is great for pain. And then a point by your ankle on the outside of your leg, 4 finger lengths up, again, from your outside ankle bone, your lateral malleolus. In between the tibia and there's a tendon, you'll feel it. It's quite sore. This is a great point. It's called gallbladder 39. It's wonderful for ligament pain, bone pain, just aches and pains in general. And then hot flashes, the dreaded hot flashes, supportive care. This is where, acupressure, I don't know if it helps as much. I teach people the points, but just from what I've heard back, it's not as great as just getting actual acupuncture done. But there are some things that you can do at home. So exercise in the early morning, getting like 20 minutes of cardio in the morning and getting a little bit of a sweat going has shown to reduce hot flashes throughout the rest of the day. Stay hydrated, drink plenty of water during the day. It can help with hot flashes in the evening. Guided meditation. There are specific guided meditations for hot flashes. They're on YouTube. There's been research shown that can actually reduce the number of hot flashes you have at night if you listen to a guided meditation specific to hot flashes right before bed. So that would be something like you're on a cool mountain and snow is hitting your face and the breeze is brushing by you and just getting you in a mental state that you're like in a cold location. That's super helpful. Alrighty, and nausea and vomiting. This is pretty well managed from what I have seen with pharmaceutical agents that they give you the week of treatment. So I don't see a lot of nausea. If I do, I always recommend, try ginger, try like a gin chew. It's a candy, chewy candy, or try peppermint tea. It might be a warm based nausea or cool based nausea. Peppermint tea is very cool based, and ginger is obviously quite warming. So try both of those and see what can help. Qigong is wonderful. It can like settle the stomach from going upwards. Qigong can be great. Starch-based foods, just have a baked potato sometimes can settle your stomach. And then acupressure points. There are acupressure bands on Amazon. They range this guy that's a little bit more high tech. It's like $120. The one on the right is about $10. So it's just holding the point, similar to an acupressure seed. So I have one here today to kind of show you. And this is on pericardium 6, which is our acupressure point for nausea. It is 3 finger lengths from your wrist in between these 2 little tendons. We're just going to hold that when you're feeling anxious, or put that band on. It should not be up by the wrist. It needs to be 3 finger lengths down. And you can also try the point called Run 12, which is halfway between your sternum and your belly button. So find your sternum, which is where your rib cages meet, and then your belly button, and go halfway down and press on that point. That can also be very helpful for nausea, vomiting, feeling stuck, and things aren't quite right with your abdomen or with your gut health. And then acupuncture point stimulation for chemotherapy-induced nausea and vomiting. Acupressure has shown to help significantly with nausea, and acupuncture with stimulation can help reduce vomiting. The Journal of Clinical Oncology has quite a bit of research supporting integrative oncology practices. So if you're interested, you can go on their website. There's a huge database. So I realize I've just been chatting quite a bit and giving you lots of information, but I really hope after today, you will be empowered to create your own supportive care plan. You can talk with your doctor, your nurse navigator about this as well. But figure out what foods you like. Look at some of those dietary recommendations or those cookbooks, and maybe know that on Sundays, your week off of Sunday before treatment starts is your cooking day, and you can cook the broths or the different soups or foods that you'll love and partition them out, put some in the freezer, have them ready for the week before your chemo treatment starts on, say, Tuesday. Some people do get acupuncture massage the day before or the morning of treatment. This can be really helpful in navigating and mitigating side effects, or even 2 to 3 days after treatment. There's a steroid crash that can happen, and acupuncture has shown to help ease that a little bit and calm that down, so it's not as much of a crash. Do the acupressure points at home. You can do them daily. Use your seeds. I wouldn't leave the seeds on for more than 3 days, then I would take them off. But something that you can just press yourself, you can absolutely do that every day. And then regular exercise that you actually enjoy practicing. I don't recommend doing anything that you don't enjoy doing. So if you're not into sprinting, then just go on a walk. Or if you're not really the cycling, I'm not a cycling person, but I like to go on a bike ride, so I'll do that with friends. And so figure out something that works for you and include it in your weekly schedule, and find some type of breath work or stillness practice that you like to do. The world is very busy right now, and during and after treatment is very busy. And if you can just find some time every day to have a little bit of a quiet moment where you can focus on your mind and your body, it's very centering, and it's incredibly helpful just to kind of find your grounding with all of this. And then, of course, the routine sleep schedule that we chatted about. I think that if patients and if caregivers and loved ones can feel empowered that there are things that you can do at home, there's plenty of things you can do at home to help yourself. You're a part of the team, and you're a part of your care plan, your cancer care plan, and a part of the decision making when you're going through treatment. It's really important, and I think it's incredibly valuable. So I encourage everyone to take what you can from this and maybe explore other options as well, and figure out what works best for you. So with that, just a little summary that we just chatted about. If there's any questions.
Yes, we got lots of questions for
you.
you.
We can fire
the chat has been busy, so I wrote them down, and we're just going to start going through. Attendees, if you have more questions that come up, feel free to throw them in the chat, and we'll get to as many as we can. I do want to let everyone know, reminder, I saw a few questions come in. This is recorded, and you're going to get the recording in our follow-up email. And Mari was super gracious enough to PDF her slides, so if you're hoping to reference back to her slide information, that'll also be included in that follow-up email for you. All right, our first question we got was towards the beginning, and it's, how does cupping therapy affect the lymphatic system? Yes,
so the lymphatic system is very superficial in our body. So we have our vascular system where our blood vessels go, and then we have our lymphatic system where our lymph travels. And cupping creates suction on our muscle tissue, and it creates a negative pressure that allows fresh blood to come to the area, but then there's space stretched between your fascia and your muscles, but your lymphatic system is in that as well. So because the negative pressure allows for lactic acid buildup to come out of the muscles, now we're taxing our lymphatic system to have to process what we've just asked to come up to the system and get rid of. So if your body is already processing chemo, it is already processing immunotherapy drugs or any other agents, we don't want to overtax the lymphatic system to process more. So we have to be really mindful of cupping therapy. Make sure that you go to someone who really has training. If you're going to get cupping, make sure you go to an oncology acupuncturist or oncology massage therapist with lymphatic education who knows what the heck they're doing, because it can make you feel really yucky if you don't.
And then I'm going to kind of cup these two questions together. Are there acupuncture contacts that you would share, and then kind of like a slash Is there a trustworthy website or database that you would encourage people to go to look up?
Absolutely. So I can, depending on where you're located, there are two oncology acupuncturists in the Austin area. Mitch Schreiber at the Cancer Wellness Center. They are absolutely wonderful. They have all the advanced training that is recommended. They're in Central and South Austin, and then I'm located in North Austin. And we also have, we are collaborating together with our nonprofit to offer community-based acupuncture, oncology acupuncture at a sliding scale rate if you don't have insurance coverage. So in the Austin, Travis County, Williamson County area, there's quite a few options. There is the Society for Integrative Oncology. I'll put it in the chat here. There is a database on their website of members who are a part of the Society for Integrative Oncology. So that is national and some international contacts as well. But you can find physicians, nurses, nutritionists, acupuncturists, everyone who has education and interest in working together for the cancer care community are most likely a part of that database. And you can always email me too. My contact's on here and I'll help you find someone.
Awesome. Okay, let's see. Okay, this came up when you were talking about food therapy and you were mentioning those cookbooks. Is there anything that might help with drug-induced bone pain? Mine so far is mostly in my hands. I've been on the drug for 8 months of the 10 years I'm supposed to take it.
Okay, and in terms of food, besides staying hydrated, I don't know many specific foods that can help for that. I do know that movement helps, like the exercises we talked about can be really helpful. The first 8 months are rough with that medicine. Acupuncture, acupressure can help. So massaging certain points is wonderful. And then the CBD menthol cream is really helpful. Epsom salt baths can be helpful. But otherwise, really, they just encourage hydration, unfortunately. Yeah.
And then do you know, I know you're in the Austin area, so I'll ask you, but are there any home delivery meal services in the Austin area or nationally that you know that cater to those living with cancer?
Ooh, you know what? Can I get back to you? I will write that down and I'll make sure that we email everyone the answer to that. I was just talking with an oncology dietitian about that. And she was checking in to see it. There was one, but I'm not sure if it's still around. I'm not sure if it survived COVID. But there is, Snap Kitchen has wonderful pre-made meals. They're in the Austin area. I think they're in Dallas. I know they're in most major cities, but at least they're healthy, nutritious, portioned out meals that you can order ahead of time. And it's not like you get it together and you still have to cook it, like it's already pre-made. And but Snap Kitchen is great. That might be an option to get you through, but I'll check back and get back to you.
And we can include that in our follow-up email so everyone.
Oh, okay, perfect.
All right. You might have touched on this, but if not, let's just reiterate. What therapies would you recommend for lymphedema?
Yes. Okay. So lymphedema, there on our nonprofit website, there's a huge there's a lot of videos. So we have a lymphedema support group. But lymphatic, you need to find a manual lymph drainage, lymphatic massage therapist, or a physical therapist that has training in lymphatic massage. Texas Oncology has physical therapists that have lymphatic training. There are multiple in the Austin area, Georgetown area. I am sure they're in Dallas because that's just something that's really important to Texas Oncology that they provide. So there's it would be a physical therapist that has lymphatic massage training. And it's advanced training, so you can't just go to any physical therapist. But lymphedema, you want to make sure that you're fitted right with your garments, that you are measured properly. And if anyone here doesn't have lymphedema but might have surgery coming up, always get yourself measured, your limbs measured before lymph nodes are removed so you have a baseline. But on our nonprofit website, I'll put it in here, we do have a lot of free resources regarding lymphatic health and education for that.
Awesome. What exercises, we kind of had talked about during neuropathy supportive care slide. Are there exercises that you could do to help with feet regarding neuropathy?
Absolutely. So the Tai Chi, because you're moving and standing, that's great for movement, balance, and blood flow to the feet. You can even just have those little buckets I talked about with your fingers, put them in your feet as well, like have the separate buckets for tactile therapy. Moving your toes around and tapping them as well is really helpful. But Tai Chi, Qigong is great. Pilates are the nonprofit does, I don't mean to keep talking about the nonprofit, but they do have we have free Pilates, free yoga, cardio classes. All of the trainers have oncology training. So working with someone that has oncology training, any type of movement is going to increase blood circulation to the feet.
Awesome. Okay, any thoughts on neuropathy infusion clinics, their effectiveness? I get a lot of questions regarding these.
I don't know enough about them. I do know that there are a lot of like salesman people trying to reach out regarding it, but I'm just not sure. And I just don't know what on earth they're putting in the, fusion bags. And how much is, I always talk about like expensive urine. Like, are you just processing it out? Is it helping? If it does help, that would be amazing. But I've only had maybe like one person go to, there's one in Austin, and it was, one person's experience, but I don't know enough about it that I don't personally recommend them.
Yeah, that's fair.
Yeah.
And then we also were asked, do you have recommendations for brain fog due to chemotherapy?
Yes. So greens, eat your greens. Make sure that let's always start with food first. Sleep, make sure that you are sleeping as much as you can. And if you can't, then let's like figure out ways to help get you sleep. So I would concentrate on that. There's acupressure point. Acupuncture in your area would be wonderful. It helps with brain fog. There is research going on more and more about chemo brain, they call it. And it's actually there are people who have not had chemo, but have had the cancer diagnosis that deal with brain fog. And they're realizing it's not just the chemo agents, it's the stress of it all. So the stress and the trauma of the diagnosis and going through everything can definitely cause brain fog. Grief can cause brain fog. So giving yourself grace through it is incredibly important. But realizing that, staying hydrated, eating nutritious, dense foods, focusing on sleep schedule, and staying consistent, all of those things make a huge difference.
Awesome. And then I do see some more specific questions coming in about different areas for acupuncturists. And I just remind everybody that Mari shared that Society of Integrative Oncology, and I will get that link added into our follow-up email so everybody can look up your specific areas for an acupuncturist.
Yeah. And I've seen DFW a couple times, so I'll follow up. There was someone there a while ago, but she just moved to Austin. So, and now she's at a different cancer or a different hospital system, not working with oncology patients. So I'll find out DFW as well.
Okay, awesome. Well, thank you everybody for joining us today. I don't see any new questions. Mari, thank you for your time and just sharing all your knowledge with us. We greatly, greatly appreciate it. A reminder again, this session was recorded. Every registrant for this webinar is going to be getting a follow-up email from me. It'll have this recording. It'll have lots of resources that Mari shared.
Right.
And we will get that to you guys. I encourage you to stay connected with our foundation. You can like us on Facebook. You can go to our website, texasoncologyfoundation.org. We have tons of resources on our webpage for you on our resource tab. You can also go to the webinar archives page for not only this recording, but all of our previous webinars. And we cover a variety of topics. I also want to encourage you, I mentioned our ambassadors group earlier in our session, and they are actually meeting tonight. So if you are interested in joining that group, feel free to email me. And lastly, in that follow-up email, we always include a survey. We would love to get your feedback on today's presentation and our webinar series program as a whole. And if there are any topics that you are interested in learning more about, please share that with us. We love those suggestions for future topics. All right, Mari, thank you again. We
Thank
greatly
you.
appreciate you.
Thank you all so much for your time. Take care.
Yes, everyone have a great afternoon. Bye.